Suzanne Kilmer of the Laser and Skin Surgery Center in Northern California. And as many of you already know, I have a lot of lasers. I love my lasers and all my devices. We do a lot of clinical trials, and then one of my favorite things is to figure out what lasers to use, how to use them, how to change their utility, maximize the benefits. So what do we have? All kinds of things. We have lasers that treat vessels, and so depending on if you have little red vessels or big purple vessels, or maybe a child with a port wine stain, or hemangioma, there's all different kinds of lasers that will use hemoglobin, which is what is the chromophore, or the thing that gives color to vessels. And we can utilize that chromophore, whether it's oxygenated hemoglobin, which is redder, or deoxygenated hemoglobin, which is purple, to best pick the laser that we would want to use to treat those. And the size matters as well. So if you have a little tiny vessel versus a big, large area, we will probably use different lasers with different pulse widths and different wavelengths depending on what the chromophore and the size are. We also have lasers that help with hair removal. Who doesn't want to remove hair? Both the men and the women, right? So depending on if you have light skin or dark skin, if you have light hair or dark hair, if you have thick hair or thin hair, we can pick amongst all the lasers that we have to best pick the one that fits your individual needs. So we can treat all skin types and all kinds of hair other than hair with no color. So the hair with no color are really blonde and light or gray. Those hairs are still trouble because we're using the melanin that's in hair, or the pheomelanin that's in red hair, to be the target or the chromophore for what the laser is using to kill the hair so that you can have successful laser hair removal. We can also use lasers for resurfacing, and in the resurfacing world we have ablative and non-ablative, and then we have fully ablative and non-ablative, or fractional. So what does that mean? Think of it as non-ablative is just heating up something, or just putting some heat into the tissue. Ablative means actually removing something or taking it away. And then fully ablative is when the whole area is treated. Fractional is when thousands of tiny beams of light go in and they either heat up the skin, which is non-ablative, or they actually heat up and physically ablate out some of the skin, which is the ablative fractional lasers. So with all those combinations, and we have several different kinds of all of those, we can go from anything for melasma, using a really mild form with a topical to improve melasma, to sun damage, where we just have a little bit of crinkling and some mottled browning, and we would do non-ablative fractional, to deeper wrinkles, where we might do a fully ablative or fractional ablative lasers to take off some of that more deeper sun damage and get more tightening out of it, to thin scars, which would be on the lighter side, to thick, deep scars, which would be a fully or fractional ablative laser that can go down to the depth of the scars. So depending on all those parameters, we have different fractional or fully ablative laser resurfacing tools to use. What else do we have? We can do tightening. We can actually bypass the surface and put heat into the skin with either radio frequency, light, or ultrasound to get light into the skin of some form of the electromagnetic spectrum, whether it's RF, ultrasound, or visible light, or infrared light, and put heat in there in different ways, tighten up the skin. We can actually use microwaves. Most people don't even know that we can use microwaves. We use microwaves for hyperhidrosis, so under the arm sweating, we can help treat that. What else can we do? We can hit brown spots. So if you have lots of little brown spots from all the sun damage, we have a laser that targets those. We can target little bumps, sebaceous hyperplasia, which are those little kind of bumps that almost look like little tiny donuts on your skin, little teeny tiny ones, and we can hit those and basically melt them away. So depending on what you might need, we probably have the right laser for you. And we are not a jack of all trades. We are a master of many, and we have the tool that will best fit your